And then we talk about having thousands of people gather together, ignoring social distancing and, talking, breathing, doing all the things that we've really been trying to avoid, and obviously not washing their hands, doing all the things that we know help to stop the spread. They're not doing those now. And so will we see an increase? Absolutely. And like you said, where is the social, moral leadership over this? Why are we not concerned about this now?
Joining me now is emergency room physician and chief medical officer at Remote Health Solutions, Dr. Jon Baugh. Doctor, thank you so much for joining me.
Thanks for having me on, Stephanie. Appreciate it.
And for those of you watching, please don't forget to like and subscribe to the Daily Caller. Now, Dr. Baugh, we had an interview, I think it was back in April, and this was kind of at the start of the pandemic. And I took questions from my social media followers that they had questions for you, and you were able to answer those. And it was very informative, and people really appreciated that segment. Now we're in June. Things have changed. We're starting to see states reopen in phases, of course, because they're trying to do it carefully so they can control the spread of the coronavirus. And now we're seeing riots and protests happening across the country with thousands of people. And in these videos, you'll see people who aren't wearing masks, who aren't social distancing. So you have to wonder, what happened with having to stay indoors?
Yeah. That is a truly concerning issue for us in the healthcare field. As a physician, I think about the social and the economic impact of all the things that have happened over the past several months. And I think about the healthcare aspects of all the things that have happened over the past few months and how hard we've tried to take positive, affirmative steps to stop the spread of the coronavirus. And now, instead, we have, like you said, thousands of people going out in the streets and sort of ignoring those social distancing rules that we felt like were really effective and that we thought we had good science behind, and that's why we implemented them to start with. And those people who do have masks on, they, about half the time you see their masks are down, especially when they're talking to people, when they're at the most vulnerable state, they pull those masks down so they can be heard and so they can talk more clearly. When they're talking to reporters, even, they're pulling their masks down and talking to them. And so I worry, quite frankly and honestly, about whether or not this is going to have an increased number in COVID-19 cases over the next coming 7 to 14 days. What are we going to see as these people are gathering together and then dispersing back out into the community, going back to their homes and taking that virus with them? What are we going to see? I think we're going to see an uptick, a big increase in spread of the disease.
Yeah, and just for our viewers' knowledge, you're in St. George, Utah, and you have been treating coronavirus patients. Now, the numbers there aren't anything like New York City or Los Angeles, California, but you are seeing patients there, and it is a real concern for doctors, especially after months of being told that we had to stay indoors because of how contagious it is. And then you're pointing out what we're seeing in the videos, people not properly wearing their masks. This is happening in cities where it's a coronavirus hotbed like New York City and Washington, D.C., Michigan. It is a real concern. So do you think lawmakers and the media are doing enough to inform people about, the social distancing guidelines right now? I remember just a few weeks ago, and I don't want to get too political with you, I know you're a doctor, but I remember when the Reopen America protesters were out, there was a couple dozen or a couple hundred, and they were doing an okay job social distancing and wearing masks, and they weren't looting or rioting or smashing windows. As a totally different type of protest. But I remember people in the media and the lawmakers saying, oh, they're putting our communities at risk. They're terrible people, so selfish. And, these are Americans who were out of work, who were wondering, when we'll ever get back to work. And now there's kind of silence from those same people who were lecturing the anti-lockdown protesters.
Yeah. It's interesting if we look at sort of that spectrum that you talk about there. So St. George, Utah, where I live, has never been a hotbed. And because of that, we were able to sort of re-advance back into opening pretty well pretty rapidly. And just in our social opening here, without the big riots, the big protests, the thousands of people gathering together, we've seen an uptick in the number of COVID patients that I see in the ER. Now, with that being said, you extrapolate that forward to the bigger cities where they're opening up, and what are we going to see there? And then we talk about having thousands of people gather together, ignoring social distancing, and talking, breathing, doing all the things that we've really been trying to avoid, and obviously not washing their hands, doing all the things that we know help to stop the spread. They're not doing those now. And so will we see an increase? Absolutely. And like you said, where is the social, moral leadership over this? Why are we not concerned about this now? I understand that this is that they're gathering for a different reason, and there's hearts that are hurt, and there's people that are wanting to get out there and have their voices heard. But we still have to remember that we are in the middle of, or the tail end, at least, of a global pandemic that has cost 100,000 lives. So what do we do with that information? Well, we continue to try to be vigilant. We try to be smart, and we also try to continue to teach others about what they should be doing and still be compassionate.
Yeah, and even the mask, as I said, and you pointed out, even if you're wearing it properly, but you're putting yourself in groups of thousands of people, because we're not at a point yet in our country where we're ready to be around thousands of people. Sporting events are still canceled. They don't even know how they're going to do that in the future. If you do go to some of the restaurants that are open, they have to have the tables like 6 feet apart or a certain amount of apart, and how many people can be let into the restaurant. So how effective is a mask in such a large gathering such as these protests or riots?
Well, it depends upon the type of mask, and that's what we've talked about from the beginning. If all these protesters or all these rioters were wearing an N95 mask, then it would still be pretty great, because it's actually a respirator, and it filters out 95% of the airborne particles. Now, if we're talking about a simple surgical mask or a cloth mask, we know that it's nowhere near that. It's mostly protectionary to be able to catch some of the small airborne droplets that go out. But there was a study recently that just showed that the saliva in our mouth actually contains more of the COVID virus than we initially thought. So even just speaking distributes some of these airborne droplets that contain virus. And because they're smaller, they escape through some of these less good masks, these not as effective masks, and they're in the air longer because they're a smaller airborne droplet. So when we start talking about thousands of people together, all chanting, cheering, and yelling, that puts a lot more virus in the air without a doubt.
Another thing I noticed was a lot of young people out there. And so we know that young people, aren't as vulnerable when it comes to coronavirus as our elderly folks or immunocompromised people. So is that something that you noticed as well?
Yeah, almost all of these individuals are young people. And so I think that the mentality is saying, I'm not sick, I'm not going to be sick. But I think there is a second thought that is maybe not being had, and that is, well, who am I going to get sick? And there's no perfect answer right now as far as is social distancing perfect? We don't know, but we're trying hard to do with it. Are we on the steps to be able to reopen the country? Absolutely. Are we there definitively across the country to be able to sort of blatantly ignore all these? No, we're not there, but we are in the process to be able to reopen it. And we need to do it slowly. So when we talk about these large gatherings with a lot of youth and a lot of anger and a lot of animosity going out there, I feel for them. I understand their desires to try to be heard, but we also need to be smart about how we do that. And that's my biggest plea is let's just be smart. Let's talk together, but let's be conscientious of ourselves, our health, and other people's.
And not that this is the majority of the people who are protesting and rioting, but there's been videos out there of people drinking alcohol, smoking pot, people arrested for that. And especially in this size of group of thousands of people, that's probably not the best decision.
No, yeah. If you think about even just the physical action of smoking and exhaling, whether it's vaping or tobacco or marijuana, THC, that exhaling of large plumes, we actually see that going out, and we have to know that in each of those big exhales, there's COVID virus that is being pushed out there, and the larger the groups that go out, the more that's going to happen. And also those things also lower our immunity. They lower and weaken our immune system. So we're hampering our ability to be able to fight, protect, and increase the spread of the coronavirus just by doing those actions.
Do you think that these protesters are putting the medical community at risk? Because at the end of the day, doctors like you are the ones who are going to have to treat the patients who come in with coronavirus.
Yeah, I think if we look at that and we say, what do medical professionals think about the riots and the rioters and the protesters? I think that we share the same thoughts as the rest of America, but we also add to that our first drive for most people that are physicians, most people that are in healthcare, is they want to heal, right? They want to do good. And so then we see this initial video, like you talked about with George Floyd, and that hurts our heart as much as it hurts anybody's. But then we look at what are you doing? What are the protesters? What are the rioters doing to endanger us, our families, them and their families with the coronavirus? That's one aspect of it. And then we also look at it and we say, we are a compassionate group of people. Let's not be actively out hurting other American citizens. Let's not be taking away their businesses. Let's not be destroying their livelihood. So there's two ways that I really think that physicians in particular are affected emotionally by this. We want to take care of people. We don't want people to get sick by silly actions of not social distancing and ignoring the rules and things that we know have helped. Then also it pains us to be able to see innocent individuals hurt or their livelihoods destroyed as well.
Yeah, there are a lot of things to consider here, as you mentioned, and just the coronavirus in general and like the lockdown. There was suicides, and there was an increase in alcoholism and drug use and depression and all of these other health issues that came along with having to stay home. And now we have the riots and the protests where there's acts of violence being committed. People have died. We saw a former police officer was killed by a looter, so allegedly, and that was just the news, I think, from last night. And so, yeah, I mean, this impacts the medical community, as you pointed out. Do you think more doctors will be speaking out against what they're seeing?
I think so. I think that us physicians often try to take a very measured line of trying to remain sort of apolitical and showing all people, citizens, non-citizens, it doesn't matter, race, creed, color, it doesn't matter. We just want to take care of people and we want to help them get better. But we also want to be smart about how we're doing. That's why physicians are our first educators. Usually we try to educate people on the things that they should be doing, the things that they shouldn't be doing, how to be healthy, and how to get healthier if they're not. And here's one great example for us. We can, as physicians, step out and voice our opinion and say, we need to be smart about this. Let's have some protests. Let's use our First Amendment. Let's have free speech, but let's do it in a smart way. And let's have conversations that make sense about how do we change our interactions? How do we change our society?
And maybe you can clarify this for me. You said we're kind of towards the end of the coronavirus pandemic, but you're expecting a second wave. Do you have any idea what that will look like? Do you have any predictions? Obviously, you don't have a crystal ball, but
I wish I did.
Yeah.
I wish I had a crystal ball. That would be fantastic. What I do mean by that is when we look at this first wave, for sure, we feel like we're coming towards the end of it. But I do think that we're going to see a second wave. Almost every epidemiologist agrees with that. And when and where that starts and how high or how dense that will be, we don't know. But I do think that because of the laxening of the social distancing, that's one reason, right? We're going to see an uptick. And I know, like I said before, we're seeing that now as we have these greater and greater congregations, these greater population density areas coming back together. We're going to see an uptick again. But will it be as severe as before? We don't know. one of the things that we do know is as they've done the antibody testing, our exposure rate in these communities is not as high as we had hoped. We were hoping that people had been asymptomatic and exposed, and they already were building up some antibodies and some level of immunity. But as we do these antibody testing, that our level of exposure and our antibody levels in general population is not as high as would be needed to have sort of this herd immunity. So without a doubt, it's going to be with us. Whether that variation of the virus this fall and next spring are going to be more severe or less severe, that has yet to be seen.
Well, Dr. Baugh, we'll leave it here. Thank you so much for your insight and everything that you're doing. We appreciate it.
Thanks, Stephanie. Appreciate it.